Hi, this is Yaffi Lvova, registered dietitian nutritionist with Baby Bloom Nutrition, and this is my little baby Bloom, Daniel, who is joining me today because his nap was pretty awful. So today we're talking about PCOS, Polycystic Ovarian Syndrome, and you may have heard of it. It's kind of a hot diagnosis lately over the past few years, and it stems from when women go to the doctor for infertility reasons. A lot of people are diagnosing it at that point, getting it diagnosed at that point. And now, since it's more popular, it's more common of diagnosis, people are also catching it at other times, which is really great because they can get it under control so it doesn't lead to infertility. So let's talk about what it is. PCOS, Polycystic Ovarian Syndrome. If you break down the words, it's really just you have multiple cysts on your ovaries. It was discovered, it was first noted in 1845 in France, and at that point they were doing surgery for removing all or part of the ovary in order to control it. So as I mentioned, the diagnosis is when they find ovarian cysts, and that can be, you show a host of symptoms, you get sent for an ultrasound, which is not very comfortable. I can report on that personally, and they find ovarian cysts, and the cysts themselves lead to hormonal imbalance. Want more peace? There we go. Lead to hormonal imbalance, and hormone imbalance comes in a cascade. What does it mean by cascade? It means if you were to stack up dominoes and knock them over and they all knock each other over, that's a hormone cascade. You have one problem and it causes a host of other problems. You want to see yourself on here? Is that the problem? Okay. He needs to be a guest host here. Maybe that will keep him calm. No? Oh, okay. So, all right, back to me then. So one of the main problems that you're going to find with PCOS is insulin resistance. I'm just going to grab him. Okay, so insulin resistance. I'm sure that you've heard about insulin as far as diabetes and other hormonal imbalances. Oh my God. Okay. Insulin resistance is when your body does not react to the insulin that's being produced by your pancreas the way that it should in an ideal world. And that means that the sugar that's in your diet, whether it be from a whole food source or from a Snickers bar or whatever, it's not getting into your body tissue the way it should because your body is not reacting to the insulin. Sometimes it's not producing enough, but with insulin resistance, it's just that the insulin is not effective enough at getting that sugar from your blood into your body tissue where it's needed. So it's kind of like water everywhere, not a drop to drink. You have sugar everywhere, but it can't get into your cells, so your body can't use it. This is a side effect of polycystic ovarian syndrome, and that's how it's related to diabetes. The hormone imbalance also causes an increase in androgens. Androgens are a class of hormone that are cause body and facial hair, acne, and they can cause you to stop ovulating or to ovulate very irregularly. So what's interesting is that although women with PCOS will often ovulate irregularly or not ovulate at all, there is also a chance of multiple gestation that's about 9 times higher than the controls in particular studies. So someone with PCOS will likely have trouble getting pregnant if their PCOS is not managed, but they will also have a higher likelihood, much higher than average, of having twins or triplets. So heads up on that one. I once had a patient in the hospital who had PCOS and was pregnant with quintuplets. So that's when I was finding out I was pregnant with twins. It really put things in perspective for me personally. I have fond memories of that. So what are the symptoms that you might look for with PCOS? Well, you might be cranky, like this kid. Acne, you have higher weight than you would like, and you have a lot of trouble losing weight. And I'm going to really address that in a few minutes. You have unwanted hair on your face, on your chest, on your belly, on your back, and that hair is thick, but the hair that is on your head can be thinning a little bit. What's up with you? Here. Work on your painting. Work on the painting. There we go. You can have irregular or painful periods with heavy bleeding, lots of cramping. You're going to be stuck in bed for the whole day, the first day. You might experience depression. You might have elevated blood pressure. You could have all of those symptoms or none of those symptoms. If your list of symptoms that you specifically have are concerning to your doctor, you'll be sent for that wonderful ultrasound to see if this is a diagnosis that fits your condition. Okay. The first management that the doctors really defer to is birth control pill, and that's completely not helpful if you're trying to have a baby. Just putting that out there. Hi, I know. Look. Okay. There we go. We're going to the default. So, where was I? Okay. So, other interesting things that this is like a joke. Okay. We're taking this for a walk. Okay. You may have heard of the drug Metformin. Metformin is a very common drug that's used in treatment of diabetes, generally diabetes type 2. Metformin actually was first developed as an infertility drug, and now it's used that way as an off-label use. This is not fun. Now it's used that way as an off-label use, and it's used for women who have PCOS and who are having trouble regulating their blood sugar, and when this is determined to be the factor that is preventing them from getting pregnant, a doctor may incorporate metformin. A doctor may incorporate metformin into their routine in order to keep blood sugars under control and to help achieve or maintain pregnancy. Another thing that you can do is quit smoking. If you are a smoker, if you smoke cigarettes, that actually increases androgen levels, which increases symptoms of PCOS. So if you have unwanted hair or acne or certain body fat, smoking cigarettes is actually going to increase those symptoms. So you definitely want to quit. Just one more of 1,000 reasons why you should quit smoking. So the number one piece of advice that you'll find when you research treatment of PCOS is that you need to lose weight. And of course, Elisheva would join the broadcast right now. I'm sure you have something to say. We're in a fun group together about intuitive eating, and I'm going to get to that because this is a very important thing. So the number one piece of advice is to lose weight. So I'm going to get back to the fact that I had mentioned that a symptom of PCOS is inability to lose weight. So it's completely not helpful for your doctor to say to you, well, you can get this under control if you lose weight. Because, hello, it's very difficult when you're experiencing this hormone cascade to drop any of that weight. So it's just not helpful advice. So what should you do? Well, you should look into the Mediterranean diet. I know that I don't advocate specific diets. It's really more of an eating plan. You're going to focus on more complex carbs instead of simple carbs. So you're going to eat Ezekiel bread instead of Wonder Bread, for example. You're going to help your body to digest carbohydrates more efficiently by pairing it with anti-inflammatory fats, by pairing it with protein. Increase the amount of fiber in your diet, and that's going to really help you to stay full, to feel satisfied, and to achieve more health. And that's going to get that hormone cascade under control. This is me trying to be a Pinterest mom. It didn't work out so well. So a lot of places reference the glycemic index, and that can be a very confusing topic. It's best to work on with someone one-on-one for that. And really the advice for glycemic index is to focus on foods that are going to be higher in fiber and have a lot of micronutrients, as opposed to focusing on Twinkies. Make sure your diet is varied. You have a lot of variety in your diet, because you will be able to self-regulate and get a good variety in your diet if you open yourself up to different types of food and you don't get yourself caught in a rut. If you feel like you're in a rut, I have a fantastic Pinterest list. You can look at some of the recipes I've posted to really diversify your diet in order to make sure that you have a lot of colors going on and a lot of different types of nutrients. You want to focus on anti-inflammatory lifestyle. And I've touched on this before. A lot of anti-inflammatory fat, walnuts, fish oil, which is often in supplementation. If you are using fish oil for a specific condition, it's very difficult to get it by having servings of fish. You'd have to have about 6 full adult-sized servings of fish per week, and that's the fatty fish. That's tuna, that's salmon, mackerel, and a couple of others, in order to really get that benefit. So it really is best to have a supplement if you're going for that. You're going for anywhere between 500 and 1,000 milligrams of DHA, it can be very difficult to get in your diet. There was an article specifically touching on walnuts, and women who had PCOS who incorporated walnuts into their diet had a higher level of ALA, which is anti-inflammatory fatty acid, and it's a wonderful thing. So whether or not you have it, if you think that you have PCOS, grab a handful of walnuts. It's really not going to hurt you. Asterisk, unless you're allergic to walnuts. So, I mean, take it all in stride. You want to have an anti-inflammatory lifestyle. You want to incorporate happy movement. You want to get a good quality of sleep. And these are all things that can be addressed with your primary practitioner. But having that anti-inflammatory lifestyle is not only going to cut down on the inflammation directly, but it's going to interrupt the bioavailability of testosterone in your system. And the testosterone is really what's causing that unwanted facial hair and the acne and all of that. So that really is going to work for you in multiple ways. So happy movement, I mentioned that. Exercise, but if you don't like lifting weights, do something else. I like Zumba, I like yoga. Find out what you like and do that. Other supplements that might be helpful, I mentioned vitamin D, or I mentioned fish oil, vitamin D as well, and that level of supplementation is going to be based on what your levels are. You want to go to your doctor and have your serum vitamin D checked to see exactly what level you should be getting. Vitamin D it's practically an epidemic that people are low in it, and it causes a lot of different health problems when you're low in vitamin D. So get your levels checked and supplement appropriately. Your physician is going to be able to guide you as far as what an appropriate supplement level is for you. Check your sleep quality, your stress management. Try to do some breathing or take a walk, something in order to help keep your stress level down, because stress causes inflammation and is going to make your symptoms worse. As I said, look into the Mediterranean diet. Lots of beans, lean meat, whole grains, anti-inflammatory fats, nuts, and fruit as a snack. It really just comes back to what Michael Pollan said in The Omnivore's Dilemma: real food, not too much, mostly plants. That's really what you're looking at. So here's my outro. I am starting a meal planning boot camp, so if you want to participate in that, drop me a line. If you are a Phoenix local, come to Toddler Test Kitchen at the Hallie Hart Children's Museum. I do private counseling and small group counseling on the phone, so if you are not a Phoenix local, or if you just had a baby and you're having trouble getting out of the house, I can help you still. And check me out on Pinterest, Facebook, and Instagram, and I'll be here next week for Nap Time Nutrition at 1 p.m. 1 p.m. Arizona time, 3 p.m. Eastern Standard Time, and I think it's 12 in California right now. So if you have any topic suggestions or questions or comments, please feel free to comment below, and I'll see you next week.